Melissa helped a little bit by getting some of these first slides out, just to say what it is. Obviously, domain 9, evaluating and continuously improving health department processes, programs, and interventions, which none of us have, I've been told. It basically focuses on performance management, and we don't have performance management at the local level. Focus on the use and too fast. On the integration of performance management and quality improvement practices. Processes for continuous improvement in the health department. So did anybody here have performance management practices in their health department?
No.
No.
I don't think anybody in Indiana at the local level has any performance management practices. So this will be all new for us. And that's why I'm hoping that Melissa had talked about maybe using the state as some help. Go ahead, Tracy.
Sorry, I just sometimes blurt. What about employee reviews? Can we count that?
They say that's not really what we're looking at. This is like
Darn.
if you have processes that
Okay.
you've developed and how you're improving them. And as we get deeper into it, you'll see the examples that we have. But
This is more of an organizational performance management. Now, if you get down into the details, the performance of the organization does get down to the individual level, but this performance management system is looking at managing the organization's performance and efficiency.
Darn, it couldn't have been that.
So it's
not.
coming
It's
up
nothing
with
to
a
do with
system.
employee recognition, stuff like that. No, it's about how we manage and how we work and how we're supposed to get better. And improve
Now that
ourselves.
comes in workforce development,
Yes.
domain 8. So you hold on to that till February.
Remind me of that then.
Right. Any questions so far?
Yeah, so if we're really focusing on performance management and quality improvement, doesn't that mean we should have all of our policies and procedures written first?
You can do it at the same time.
Performance management can help you identify where you need
Right.
policies and procedures.
There will be parts in here about self-assessment. That will be one of the first things that we have to do on an individual county basis is look at what we have and what we don't have, doing a self-assessment of that, and that will help us then discover what we need to do, which is probably everything from our
I'm
standpoint.
only telling you, I have
We prioritize.
Right.
got nothing.
Right. So the overview for domain 9, there's 2 standards, 7 majors, 25 documents, and of course we may be able to share quite a bit of it because since we're all starting from scratch, why reinvent the wheel at every health department?
Right.
That's right. So why? Okay.
Cheryl likes you.
Okay, performance management. Identifies actual results against planned or intended results. So actually how we're performing, not what we really, not our intentions. It also ensures that progress is being made toward the department as far as by systematically collecting, analyzing data. So we'll be looking at one point we'll talk about getting feedback from the public on how our process is, say either at the immunization clinic or with food inspections, getting comments, data back from that so that we can improve the process on those departments. So you'll be looking at each individual section in the health department eventually to get some feedback on that from the public standpoint, and maybe some other agencies that we deal with, and then try to improve our process.
Do we have a performance management for the whole office or for each individual department in the office?
Well, you'll use a system
The system,
for the health department.
okay.
And then, yes, there'll be a process by which we go after each individual sector in the health department. But you don't have to attack them all at once. Like, for us, what we're planning on doing is the immunization clinic in WIC. They're supposed to be collecting some feedback this month from their customers so that we can review that in January at our staff meeting and then see maybe a better process of doing things or what's inconvenient to them. Can we make it better for the customer?
So you picked one sector, you said, like out of it.
A couple of them. Then if once we get that stuff back, then we'll like do foods and septics or whatever else we might want to do. Any questions for performance management definition? Okay, quality improvement is an element of performance management. It addresses specific targets for effectiveness and efficiency. And so that's where I came in. That's where when I went to Lafayette for the yellow belt QI training. So what I have done, and I'll get to that here a little bit later, but we had a quality improvement project for domain number 9. And so must have been, was that May or March? Came up, there was a meeting, and Melissa's like, we could get you in this, but I was the only one available to go at the time. So I went there, and I've been working on some paperwork and a project under the complaints issue, trying to unify all 5 departments, and we'll go over that today later, and see what you guys think, get some feedback from that. And if that looks decent, we'll start that January 1st, do a 3-month review come April 1st, and then if that looks like it's been working well, we'll submit that to Purdue, and then if accepted, then we'll have the documentation to then put in with domain 9. So the quality improvement project, we've already started that, so we'll talk about that.
Thank you, thank you, thank you.
It wasn't too bad. Okay, so quality improvement is the public health use of a deliberate and a defined improvement process that is focused on activities that
Typo.
are responsive to community needs and improving public health. So as we look at, say we use immunization clinic like we're doing for feedback, we're not looking at processes in the clinic that doesn't affect public health. It would affect public health. We're not going to look at, maybe response time might not be an issue for us, but are we vaccinating everybody efficiently? Are we getting the kids at school vaccinated in a good in an efficient manner? Or what are our percentage levels? That's what we're going to be looking at. Not necessarily was your wait time long or anything like that. That's not really something that improves public health. So there will be specific processes that we'll have to use. Any questions about that? I know that might be kind of confusing, but anything else about the definition here? It's quite lengthy. I won't read the rest of it. No? Okay.
If you want to read it word for word, it is straight from standards measures.
Okay, so self-assessment tool. I didn't get your email till about 10 minutes ago
Okay.
about how to connect PDF files to your
I
to
said
the
that right away,
presentation.
too. That's weird.
It's the computer system here. Now I gotta find my, there it is. I need to find my thumb drive. Okay, it's gonna be in there. Okay, so self-assessment tool.
Done.
Is that up there?
Nope.
Do I? Unless you completely turn off the presentation. It might have lots of them, might not. That's-
No, we'll get it on there. I just thumped the recorder. I'm gonna stop taping on this. We'll get this figured out.
We have PDF files on